Okay, let's talk about something that affects so many of us, hand and wrist pain. You know, our hands are how we connect with the world, right? So when they start to hurt, it can throw a wrench in, well, pretty much everything. So we're going to dive in, figure out what's really going on, and most importantly, talk about how to get you feeling better.
So, does this sound familiar at all? You know, that little twinge when you're typing away, or that ache you get when you're gripping the steering wheel. Maybe it's that frustrating moment when you feel a weakness just trying to hold your morning coffee. Look, these aren't just little annoyances you should ignore. They're actually really important signals your body is sending you.
And those signals are so crucial. I mean, think about it. Our hands are everything. They're our tools for our jobs, they let us enjoy our hobbies, and they're a massive part of our day-to-day independence. So yeah, it's time we get to the bottom of why they hurt.
All right, first up, Section 1, decoding hand and wrist pain. Let's start by figuring out the usual suspects behind that nagging ache.
So, it might seem complicated, but a lot of the time, hand and wrist pain really boils down to one of three things. You've got repetitive strain, from doing the same motion over and over again. Then there's a straightforward injury. And finally, just the natural wear and tear that happens as we get older.
Okay, let's tackle a big one, carpal tunnel syndrome. Honestly, the easiest way to think about this is a pinched nerve. Imagine a tiny tunnel in your wrist. That's the carpal tunnel. When the main nerve that runs through it gets squeezed or compressed, well, that's when you get that classic numbness, tingling, and weakness.
Then there's something called trigger finger. This one's pretty descriptive. Basically, a tendon in your finger gets inflamed, so it can't glide smoothly like it's supposed to. And the result? Your finger might literally catch, or click, or even get stuck bent. It can be super painful and honestly a little scary when it happens. And of course, we have to talk about arthritis. At its core, this is all about wear and tear on the cartilage in your joints. Think of cartilage as the protective cushioning between your bones. When that cushion starts to wear down, you're left with inflammation, stiffness, and pain that can make even the simplest movements a real challenge. Okay, moving on to Section 2, listening to the warning signs. It's one thing to know what these conditions are, but how do you know when it's time to actually do something about it? Let's get into that.
And this is really the million-dollar question, right? We all get random aches and pains. So how do you know when it's more than that? When does it cross that line from, oh, it's just a temporary thing, to, maybe I should get this checked out?
So here are the big ones to watch out for. Think of this as your personal checklist. Are you getting numbness or tingling in your hands or fingers? Are your fingers locking or catching? Does the pain get way worse when you're doing something like typing? Other huge red flags are losing your grip strength, or having persistent stiffness or swelling. And a really big one, if the pain is actually waking you up at night. These are your body screaming, hey, it's time to get some help.
Okay, so let's say you've recognized some of those signs. Now what? Well, that brings us to Section 3, the path to recovery. And the good news here is that there is a clear path forward. Think of this as your roadmap to getting better. It all starts with Step 1, a proper diagnosis to figure out exactly what's going on. Then, the first focus is almost always on non-surgical stuff. After that, you look at more advanced options, but only if they're needed. And it all wraps up with rehabilitation to get you back to 100%. Now, this is a really important point, so I want to hammer it home. The first thing a doctor will do is not to suggest surgery. The first line of attack is always non-surgical. We're talking about things like splints, physiotherapy, maybe some medications or injections to manage the symptoms. Surgery is really only on the table if those other things just aren't cutting it and the symptoms stick around. And that leads us right into our final section, which is the most hopeful one of all, reclaiming your dexterity. This is what it's all about, right? Getting your life back without the pain. So this right here, this answers the biggest question that's probably on your mind. Can I actually get my full strength back? And the answer, in most cases, is a huge yes. You can see it right here. With the right treatment and rehab, your grip strength and your mobility can improve, not just a little bit, but significantly. That's not just a possibility, it's the expectation.
You know, the biggest takeaway from all of this should be a message of hope. Don't let pain write your story. These conditions, whether it's carpal tunnel or something else, are absolutely manageable. You don't have to just live with it.
And with that, we're at the end. But I want to leave you with a question to mull over. What's just one daily habit you could change to start protecting your hands? I mean, it could be something small like taking more breaks from your keyboard or doing a couple of simple stretches, or even just thinking about how you grip things.
What's one tiny thing you can do, starting today, to take care of those incredible tools you have? Thanks so much for joining me.